RevoFit coding strategies. Practitioners commonly ask us for coding recommendations. We are here to help. Not only to provide you with codes that you may use, but also with the process and strategy you will need to successfully code each and every time. In this video, we will take you through the strategies that we commonly use and provide you with documentation you can use to get paid. One thing to remember throughout this process is that RevoFit is a component of the overall socket. Adjustability in and of itself does not come with a code. Rather, the overall construction elements of the socket will qualify for various codes. We will outline the codes you can use for specific elements of the construction. In addition to these codes, you will utilize your typical add-on codes. These strategies are ones that many practitioners have utilized successfully. That said, choosing proper codes is ultimately up to the practitioner and must be properly supported and documented with medically necessary patient indications. We have identified two different pathways for you to consider. We also provide supporting documentation that will help you easily submit for reimbursement. Let's look at Path 1. This is appropriate for mature amputees who are fairly easy to fit, or those who are not significantly fluctuating. Overall, there are 5 steps. 1. Making a check socket. 2. Outfitting that check socket with adjustability. 3. Fabricating the laminated definitive socket. 4. Delivering the socket to the patient. 5. Billing insurance. Here are the details. 1. Fabricate and fit the first check socket to verify fit and volume. Utilize code L5620. 2. Once it's fitting properly, add the RevoFit check socket kit to the check socket. Fit the socket to the patient, verify panel size and placement, and test the functionality. For this step, utilize a second L5620 code. 3. Pull the flexible insert and then fabricate the final adjustable socket. Utilize codes L5301, L5645, and the optional L5999 code. 4. Fit the definitive to your patient, tune it, and instruct the patient on proper usage. Bill to insurance. With this strategy, you will have the opportunity to bill for $7,425, plus any additional add-on codes that you normally use. To ensure billing success, utilize the supporting documentation that we'll go over in a moment. Now let's look at Path 2. Path 2 is similar to Path 1, but it integrates the flexible insert earlier in the process and has an option for delivering a prep socket. This path is appropriate for patients that are more complicated to fit or newer amputees who may still be fluctuating. Overall, there are 6 steps. 1. Making your first check socket. 2. Making a second check socket and the flexible insert. 3. Outfitting the second check socket with adjustability. 4. Creating either the laminated definitive socket or the prep socket. 5. Delivering to the patient. 6. Billing insurance. Here are the details. 1. Fabricate and fit the first check socket to verify fit and volume. Utilize code L5620. 2. Fabricate your second check socket, but do so after pulling the flexible insert over the mold. Utilize codes L5645 and L5620. 3. Add the RevoFit check socket kit to the second check socket. 4. Fit the socket to the patient. Verify panel size and placement while testing the overall socket functionality. If your socket design works well, then build the definitive socket using the check socket as your guide. Be sure to utilize the flexible insert you made earlier for the definitive. Utilize code L5301, the optional L5999 code, plus any add-on codes you normally use. If you need or want to test the socket over time outside of your office, then reinforce the check socket with fiberglass and deliver it as a prep socket. Utilize code L5530, the optional L5999 code. If the prep socket comes back working well, then build the laminated definitive socket and bill L5301, the optional L5999 code, plus any add-on codes. If the prep socket does not work well, then revert back to step 1 to adjust the socket design for your patient. 5. Once your definitive socket is fabricated, fit to your patient, tune the fit, and instruct the patient on proper usage. Bill to insurance. For Path 2A, going straight to the definitive, you will have the opportunity to bill for $7,425 plus any add-on codes you normally use. For Path 2B, utilizing the prep socket, you will have the opportunity to first bill $6,825. Later, when you build a definitive socket, you will use code L5301, the optional L5999 code, plus any add-on codes you normally use. Path 2 is slightly more complicated, but it provides the opportunity to test the functionality and design of the adjustable socket prior to fabricating the laminated definitive socket. Now let's look at the billing resources. In order to make submittals easy for you, we have provided the necessary codes that you will normally use. We have also provided documentation for you to submit for additional reimbursement through an optional 599 code. We provide an MSRP for the optional 599 code. Some of you may not often submit for 599 codes, but we highly recommend it. Utilizing this code allows you to bill for the adjustment components and for the design and fabrication of the adjustable portions of the socket. When the 599 language is combined with a letter of medical necessity, it commonly results in payment for adjustable sockets. On our website, you will find a pre-drafted letter of medical necessity and an easy-to-use coding calculator to streamline this process. Using these tools, you can confidently submit for significant reimbursement, and you'll realize pretty quickly that these steps are worth the effort. So, what's the bottom line? Using our coding strategies, the provided language and justification, and our MSRP, you can bill for significant reimbursement when creating adjustable sockets. Combine this with the fact that you will reduce socket remakes and refitting events, all while creating happier patients with better outcomes. And, well, you just can't go wrong. It's better for you, your patients, and your bottom line. Can you adjust? We know you can.